Okay, so we got some slippery juice on here, and we're going to use a nice broad edge just to kind of check things out through here, up and down, a couple of nice wisps. I like to drag it back, depends on their sensitivity, push it up. I don't do it. This would be more of a scraping, this is more of a dragging back, scraping forwards. I like a little bit more of a gentler angle on that. This is a sharper edge. If it's too sensitive, this is a duller edge. We can come in here, and it also gets into that laminar groove a little bit more easily. Okay, a couple wisps through there, and other side into that laminar groove, through the mid trap, through the rhomboids. Okay, nice broad stroke. And even getting into a little cross friction on the multifidi, rotatories, the laminar groove, coming in through there. Sometimes we spend a little more time. We're just showing you the simple part today. Take it all the way out to the scapula. Okay, we can come up and get into levator scap. A little slower, a little deeper. If she's tolerant, if the tissue is a little bit more progressive as to your working on them, then you can come with a little more edge and push up through there, drag it back down. Elasticity range of motion is multi-directional, so you want to get those tissues going in both directions. We'll work this from the one side. If you want, you can switch over to the other side of the patient, but we're going to simplify it because we can. A little slippery, but we grasp it so it holds very nicely in the two concave surfaces. I'm not getting a lot of slippage. I'm getting a nice effect into patient's tissues. Levator scap, rhomboid, tissue flow, coming on down. Sometimes if they're very gristly, I'll take the rounded edge, blunt edge there, and go up and down with it some, with a little bit of angling, so I get a little bit of widening of that roundness, either perpendicular to it or up and down. Whenever I go up and down with that edge, I like to come back and clean it up, widen it out, and don't leave grooves in the tissue. If you're going to do that to soften it up, to break it up, then you need to widen it out, flatten it out, blend it in. Don't leave grooves. They are little separations in the tissue. We want whatever threading in the fabric to be nice and equally balanced out.